Today, we're diving deep into something a whole lot of us have dealt with, the urinary tract infection, or UTI. We're going to tell the story of what it is, how it actually happens, and why it's a battle our bodies are basically fighting all the time. You know the one I'm talking about, right? That unmistakable feeling. It's urgent, it's uncomfortable, it sends you sprinting to the bathroom, only for things to be, well, just as frustrating when you get there. Yeah, if that sounds familiar, you are definitely not alone. Those classic symptoms, they're basically your body's alarm bells, screaming that there's an invasion happening in your urinary system. So, what is actually going on inside our bodies when this happens? To really get it, we need to understand the battlefield. And believe it or not, it's about a lot more than just some bacteria showing up where they don't belong. The first clue is a word called bacteriuria, which, yeah, literally just means bacteria in the urine. But here's the thing. Just having bacteria show up doesn't automatically mean you have an infection. Think of them as scouts testing the gates. The real fight kicks off when their numbers get huge. We're talking over 100,000 per milliliter, and they actually start causing trouble. And here's what's absolutely crucial. Where the trouble is happening matters. A lot. If it's a lower tract infection, down in the bladder, that's called cystitis. This is what most people mean when they say they have a UTI. But if those bacteria travel upstream to the kidneys, it becomes pyelonephritis. And that is a whole different ballgame, way more serious, with symptoms like fever and intense back pain. So how does this invasion even happen? It's not just random chance. It's a journey, a kind of microscopic assault that follows a very specific path, fighting its way upstream into our bodies. The vast majority of UTIs happen because of this ascending route. It all starts with bacteria, usually E. coli from our own gut, ironically, setting up a little colony near the urethra. From that base camp, they start their climb up into the bladder. And if they're not stopped there, they can keep right on going, all the way up to the kidneys, which turns a manageable problem into a major one.
But listen, these aren't just any old bacteria. The ones that cause UTIs are incredibly well equipped for this mission. They have these special abilities that scientists call urovirulence factors. Just think of them as superpowers. They have these tiny little structures that work like grappling hooks, letting them cling to the bladder wall so they can't get flushed out. They can resist our body's own bacteria-killing chemicals, and even wear a kind of camouflage to hide from our immune system, all while producing toxins that actually damage our cells.
But our bodies are not just sitting back and taking this. We have our own multi-layered fortress. I mean, the simple act of peeing is a powerful defense. It physically washes intruders away. The urine itself is actually a pretty hostile environment for bacteria to survive in, and the lining of our urinary tract has its own built-in defenses. And if all else fails, the immune system sends in the troops, the white blood cells, to fight the invaders head-on. So, if our bodies have this incredible fortress, why do the defenses fail sometimes? And that brings us right to our next question. Who is most at risk? Well, the answer usually comes down to certain vulnerabilities that can tip the scales in the bacteria's favor. It's a pretty well-known fact that women are at a much higher risk for UTIs, and a big reason for that is just simple anatomy. A shorter urethra means the bacteria have a much shorter journey to make it to the bladder. But it's not just about anatomy. Certain lifestyle factors and even life stages play a huge role. For example, sexual activity can physically push bacteria toward the urethra. Some types of contraceptives, like spermicides, can mess with the good bacteria that are supposed to be protecting you. And unfortunately, once you've had one UTI, you're more likely to get another. Plus, pregnancy causes all sorts of changes to the urinary tract that just naturally increase the risk. And age brings on a whole new set of challenges, raising the UTI risk for both older men and women, but for totally different reasons. So for older men, an enlarged prostate can actually block the flow of urine. This means the bladder doesn't empty all the way, giving bacteria a perfect little pond to grow in. For older women, things like bladder prolapse or lower estrogen levels can be a factor. And for both, anything that requires a catheter or involves incontinence dramatically raises the risk. All right, so let's say the body's defenses have been overwhelmed and the symptoms are kicking in. How do we confirm what's going on and actually fight back effectively? Well, that's where diagnosis and treatment come into play. You can think of the whole diagnostic process like a criminal investigation. The very first clue is something called puria. That's just finding white blood cells in the urine. It's proof that a fight is going on. A quick dipstick test can screen for that right in the doctor's office. But the gold standard, the DNA evidence, is a urine culture. That's where they actually grow the bacteria in a lab to identify the specific culprit and confirm its numbers are high enough to be causing all this trouble.
And once the enemy has been identified, the strategy is clear. It's time to call for backup. This is where antimicrobial therapy, antibiotics, comes in. They are the cavalry, the heavy artillery that helps our own immune system finally overwhelm the invaders and win the battle. But what happens when the battle is harder than usual, or when it leaves behind lasting damage? This is exactly why it's so critical to get UTIs treated quickly and correctly. You might hear a doctor use the term complicated UTI. This doesn't just mean it feels bad. It means there are other factors involved. Maybe there's an underlying problem with the urinary tract structure, or a person has a weakened immune system. And any UTI in men or pregnant women is automatically considered complicated just because the stakes are that much higher. And the potential for real damage is no joke. What you're looking at here is a kidney after a severe, unchecked infection. See those large, irregular patches? Those are scars. That's the physical aftermath of the war that was waged inside. It's a really stark look at the permanent damage that can be done to one of our most vital organs. Now, if we zoom way in with a microscope, you can see the battle at the cellular level. That dark cluster the arrow is pointing to, that's a massive collection of inflammatory cells, our body's own army, that flooded the area to fight. But in the process, they're surrounding and damaging the kidney tissue itself, creating these microscopic scars from a long, drawn-out internal conflict. So, as you can see, a UTI is so much more than just a simple annoyance. It's this dynamic battle that starts with a tiny, microscopic invasion and can actually end with visible, lasting harm to our organs. And really understanding how that whole process works is the absolute first step in defending ourselves. So thinking about this whole journey, from the bacteria's sneaky invasion to the incredible strength of our body's own fortress, it really gives you a new perspective, doesn't it? It all leads to this one really important question. Now that you know the intricate battle that happens on the inside, what can you do on the outside to better support your